Alright, my name is Matt. I'm here with Ryan today. We're going to do a hip and back evaluation. So the first thing you want to do when you're evaluating someone is get a good history. So you're going to ask for the mechanism, what sport do you play, what causes you the most pain, point to where it hurts, pain scale out of 10, things like that. But before we do, or after we do that, we're going to inspect and palpate. So I'm going to have you lean on back. With hips, it's a lot of overuse injuries, often seen in runners. You have a lot of leg length problems usually, or the hips are rotated one way or posteriorly or anteriorly. So first I'm going to check his leg length. I'm going to loosen him up here. And you're going to look at the medial malleolus, and you're going to put your thumb on the medial malleolus to check. So he's pretty square. Also with back injuries, you need to look and see what kind of curve he's got. Does he have a lordotic curve or kyphosis or spondylolisthesis? Nailed it. Nailed the word. So first thing I'm going to have you do is manual muscle test. So I'm going to have you lean over here for me. And we are going to test hip flexion first, which is the iliopsoas group. So what you're going to do is you're going to ask him to raise his knee to the ceiling and hold it. Good. Of course, you test everything bilaterally. I'm not going to test everything bilaterally when we do this eval because it's going to take a long time. So raise this one. Good. Now lean on your stomach. I want you to raise your heel to the sky. Yep. Hold. Good. So that's pretty much testing manual muscle test. The next thing we're going to do is, since I'm back here, I'm just going to palpate. So PSIS right here, you can measure these two, or ASIS, either one. So there they are. Greater trochanter of your femur. Oop, found it. Right there. Flip over on your back for me. Also, one thing you want to look at is their feet. Do they pronate? Do they supinate? That's a major deal. And their Q angle, you also want to check that out. That has a lot to do with hip injuries. Are they retroverted or antroverted at the hip? So the ASIS, I'm going to sit right there, follow it up, iliac crest, and then greater trochanter, so on, fibular head. So let's do some special tests for the hip. So the first one I want you to do is called the Faber's test. And this is for SI joint pain. You're going to cross this leg, and I'm going to push down. He's going to be an external rotation. I'm going to push down on his opposite ASIS. And if he has pain, that's a positive sign. Any pain?
No.
Nope. Test bilaterally. That's the first one. The second one is a test for hip flexor tightness. It's called the Thomas test. So I'm going to have you scoot on up here. I'm going to lean back on your back. I'm going to raise this up into flexion, and if his opposite hip comes off, I don't know if you can see this, but if his opposite leg comes off the ground, that's a positive sign for tight hip flexors, iliopsoas, pectineus, and rectus femoris. So let's test the rectus femoris now. Flip over on your stomach. Sorry, I'm having you all do all the thing. This one's called the Eli's test. You're going to take his heel to his butt, and if his hip comes off, the affected side hip comes off the ground, that's a positive sign for rectus femoris tightness and also hip flexor tightness. So that's pretty much for the hip. Besides one more test, the long sit test. So I'm going to have you sit on your butt. This is for leg length. This is the test for hip. Posteriorly or anteriorly rotated, lean back all the way, keep going back until your ankles are hanging off, losing a hat. Can't lose a hat. So I want you to sit up, and what you're doing is you're watching the medial malleolus, and you're measuring to see if one shortens or lengthens. If the affected side where he's having pain shortens, that means it's anteriorly rotated. If it lengthens, that means it's posteriorly rotated, right? So let's talk about the back injuries. flip on your stomach. Of course, you're going to get a history. You're going to look at his curvature of his spine. You can palpate each process of the spine just by pressing. Look for deformity. Most are lower back injuries is where you're going to find most of your injuries, not in your T-spine or anywhere like that, but most are going to be lower back. So that's the test what we're going to test for today. So flip on your butt. Actually, before that, I want you to do a Superman. Remember Superman? Yep, that's how you test this. So flip on your butt now. First one I want you to do is the Valsalva. So you're going to take a deep breath in and bear down. And if you have any pain, that's a good sign of a herniation, like right over there on the wall. The next one we're going to do is the Milgram's test. So lean back. You remember, you ever have to do ab exercises where you hold your feet up like that? This is exactly what that is. So I'm going to hold them right there and you let them go. If one drops, that's nerve root pathology, herniation. Got some good abs. The next one we're going to do is called the slump test. So I'm going to have you sit on the edge of the table. And I'm going to ask you to take your chin to your chest. And then I'm going to have you extend this leg or whichever affected side's bothering them. One leg. And then I want you to dorsiflex your foot. And if you feel pain, that could be your sciatic nerve or a disc pathology. So, did you feel it with that one? Most people usually do feel the nerve stretch. One more for the hip I forgot to add is the scour. We're going to do this one, so lean back. And this is for a labral tear in your hip. You're going to apply direct pressure on his femur, and you're going to internally rotate, externally rotate. Any clicking is a positive sign, any pain is a positive sign. You're really just trying to catch the labrum. So no pain. Good. Nope. Good. So there's also piriformis syndrome, which you see a lot in back pain and hips. With that one, you know what a piriformis stretch is. Just lean back, do a piriformis stretch just like that, or you could take them in to this, where he doesn't have to do it passively, and he'd feel sciatic pain, inflammation of the piriformis also there. So that's basically it. Malvaluation.